Why is it that 90% of nurses have experienced burnout in the last year? And during their first 2 years in practice, up to a third of nurses leave their job.
And why is it that if you want to sit down and coach your patients inside of a hospital setting, talk to them about lifestyle changes, ways to get off their medications and reverse their diseases, you better be dang sure you're closing that door behind you and whispering to them very quietly. Nurses, nurse coaches, welcome back to the Nurse Coach Collective podcast. I'm Heather.
And I'm Peter.
Today, we're talking about a return to common sense healing. We have the knowledge to prevent the chronic disease epidemic. So why isn't it happening? This episode is all about bringing common sense back to the forefront of healing and reclaiming your power as a nurse. So Peter, you and I have been feeling these things and talking about them for quite some time, but to be honest, we felt like we had to be quiet about them.
The truth is, we've been in business for about 7 years with the Nurse Coach Collective. Hit that milestone of 4,000 graduates recently, very exciting. But all throughout that journey, in my mind, I felt like we had to maintain this interesting balance. This balance between speaking truth against the status quo, but also doing it in a way where, a lot's changed over the past 7 years. I feel like I'm kind of entering into more of like a I don't give a hoot moment of my life, and I'm going to say what I want to say.
Oh, I've noticed.
I'm going to speak what I want to speak. But I also feel like, 7 years ago, if you challenged the status quo, if you spoke out against the insanity of the current medical model, if you talked about the fact that we can indeed prevent, treat, and reverse 80% of chronic disease through lifestyle coaching, if you started talking about those things, it's like, geez, at a baseline, your license was at risk. I felt scared that the nursing board would come after me. I felt like I would be canceled. I felt like the Nurse Coach Collective would fade away because even though everything I was saying was backed up by evidence and it was real, that I couldn't speak about it because just like in the hospital, like my hands were tied, right? So you and I have kind of been walking this delicate balance for years and we've been speaking about it, but I think we've been speaking about it a bit more delicately. And there is this, we talked about the crisis on our last conversation and, what you expressed here today, how like, dude, if we know 80% of chronic disease is preventable, treatable, and reversible through lifestyle coaching, then like, what the hell are any of us doing, not doing that? Yeah, this feels like for me, this moment of like, whatever, guys, like, I just want to speak truth and seek truth. And so that's what this feels like for me in this moment.
So that's the truth that we want to start with, is announcing to the world and owning it that this vast majority of chronic diseases that we face in our society is indeed preventable. That's not our opinion. That is evidence-based science. So why aren't we doing anything about it? As a country, as a system, as an organization, why isn't it getting any better? And when we start to ask that question, I think a spiral of other questions begins to pour out, right?
Why do we spend more money on healthcare than literally any other country on the planet? And yet our population is more sick than, again, any other country. So we're spending the most amount of money, but we have the worst results in healthcare.
Why do doctors and nurses who spend years and years on their education and professional training receive oftentimes 0 or maybe a maximum of 16 hours of nutrition training?
Why is our entire system focused on prescribing and procedures? Why does 99 cents of every single dollar go towards symptom management and acute care instead of lifestyle coaching as our first line treatment? And why isn't it flipped? Why isn't the majority of our money spent on prevention and whole person wellness?
And like, why are we here in the US one of only 2 countries that is allowed to advertise publicly pharmaceuticals on our TV commercials, on our billboards, almost taunting and teasing the public to come and ask for more prescriptions?
Why is it that 90% of nurses have experienced burnout in the last year? And during their first 2 years in practice, up to a third of nurses leave their job. In the first 2 years, why is it that up to a third of nurses just leave the profession altogether.
And why is it that if you want to sit down and coach your patients inside of a hospital setting, talk to them about lifestyle changes, ways to get off their medications and reverse their diseases, you better be dang sure you're closing that door behind you and whispering to them very quietly.
Yeah, it's crazy. And why is it that after all of the evidence before us, the top medical organizations haven't taken a stance on the absolute fact that ultra-processed foods, high sugar drinks, are absolutely poison and awful for our bodies. And instead, they promote this weird, ambiguous, my plate or the food pyramid, things that obviously don't work. Why aren't they simply promoting a whole food diet, a diet centered around whole foods?
Why are we in the United States able to put ingredients in our foods and sprinkle pesticides over our farms, things that are literally outlawed as illegal in other countries all across the globe?
Interestingly, the pesticides that we spray in our food, the countries that they're produced in, they can't even use them because it's illegal to use them there, but they produce them there and then export them, and then we use them and poison our bodies, poison our families, right? So there are really all these intense questions that you start to ask, and we don't have all the answers. I am in no way like the absolute expert on every single one of these things, but what I do know is that, man, these things are by design. Just like the crisis of the sick care system, it is by design. All of this is designed to extract maximum profit from maximum human suffering. And it is not why I got into nursing. It is not why from the time when people started asking me, what do I want to do when I grow up? It was always very clear and apparent to me that I wanted to help people. I want to heal. It's in my nature, like pretty much every other nurse that I know. This is the work that we want to do. This is the work that we feel called to do. But we do not feel called to extract maximum human suffering from our day-to-day life.
And it's not why any of the 4 million nurses who are out there right now got into this profession. But in a big way, maybe this can be why more of us choose to do something differently. Because even if we don't have all the answers, we can still choose to stand in opposition.
So what does standing in opposition look like? You know, you mentioned at the beginning, this whole episode is about bringing common sense healing back to our work and back to our patients and our populations, to the healthcare system. What does standing in opposition to this insanity mean? And how is nurse coaching common sense healing?
Let me put it like this. One of our students recently shared a testimonial that she received from one of her clients. It was just a couple sentences long, feedback that she got from this client after working with her for only 5 sessions, 5 hours of coaching. And I don't have it in front of me. I can't quote it exactly, but this woman recounted how after working with a nurse coach, she had lost weight. She had had stomach issues for her entire life that were now dissipating. She had worked on them with healthcare providers for years and years with medication after medication, side effects, more medication. They were finally beginning to dissipate. Her stress was reducing because she began to practice mindfulness. Her relationship with food has changed. She was starting to eat more healthy food and less of those bedtime ice cream cravings. Her relationships were improving. All of this within 5 hours of coaching. And I think the kicker in all of this was that she said, I feel like I have my life back. I feel like I am now once again in control of my own health and well-being. And so after this student of ours shared this testimonial, and she's almost in tears as she's celebrating this client. But she says to me, you know, the craziest thing about all this is that I literally had the honor of witnessing this client's life transform in every single way for the better. Her mental health, emotional health, spiritual health, physical health, everything. But all of the changes that she actually made were so simple. She started eating better. She started exercising more. She started using techniques to decrease her stress. And she looked at me, she's like, I'm not an expert. I'm a nurse. I'm trained. I went through this program, but I'm not some sort of genius that magically helped this person make results. What I made possible for her was all of these things that are common sense. I helped her have the tools and the empowerment and the belief in herself to help them become common practice. That's what I mean when I say bringing those common sense practices back to the forefront of what it means to go through the healing process.
Have common sense become common practice. You're just full of cool idioms over here.
Pretty sure I borrowed that one from you at some point back in the day.
And we're
but-
just cycling them. Cool. What's so incredible about that is like, it is just empowerment, right? And so like why, when we think about like, why is it just so common for people to suffer endlessly for years and years under the weight of, a broken system that doesn't want to prevent, treat, and reverse of 80% of diseases? We now have the tools for it. So there, for me, feels like no more excuses inside of our profession. Like if you want to learn how to do this effectively and to learn it quickly, like take the nurse coach training program that we offer. It's so fast, it's so efficient, but it's also so dang empowering. And the reason is it's because like you don't have to be an expert, right? For me, when we're listing like all of these questions and that like challenge the status quo, I don't have to be an expert in all of them to help one person, to help dozens of people, to help thousands of people to transform their health and their well-being, because all that I have to be an expert in is the nurse coaching process. And the nurse coaching process seeks truth, it seeks empowerment, and it seeks transferring the role of expert from me, the practitioner, on over to my clients and on over to my patient, on over to my communities. And what that really looks like and what that means in practice is exactly what you said. It is supporting someone to believe that by taking small, simple actions, by making small, simple changes in their lifestyle, that they no longer have to live under the burden of chronic disease and suffering in a medical system that doesn't work, but they can free themselves by making those choices and those small changes that lead to huge transformations. Here's the kicker: over the course of just a few hours of coaching, right? So this person you said was suffering for a lifetime, like literally a lifetime.
A lifetime, provider after provider.
Person after person, just medication after medication, one thing after another, stacking, snowballing. And in 5 short hours, like it is the quickest of the fixes. There's nothing faster than that. Like when you think about transforming someone's life and you can do that over the course of 5 hours in a way that is then sustainable. Like if you go and circle back around with this person, it's just like when somebody becomes a nurse coach, right? They can no longer go back to that old broken model. They're stuck. They're stuck inside of the new empowering model, the new paradigm of wellness and lifestyle coaching. Same thing with this person, right? Even if they want to try, their baseline is now elevated and they are aware in such a way that they have this unbelievable power over their health, their well-being, and their happiness. They are so much more in control than they ever thought possible that there is no going back from that.
And that, I think, is absolutely fascinating when you look at that quick fix of how that process can unfold in so little time.
The nurse coaching process.
The nurse coaching
the healing
process. Yes.
The reversal of chronic disease.
The truly sustainable quick fix. Because I think a lot of times, and nurses, we are so guilty of this, we almost assume that our patients don't want to do the work. They don't want to try hard. They don't want to eat better. They don't want to exercise. They don't want to do the work or learn the skills to take control of their own health. All they want is a pill. And is there some truth to that? Perhaps, because we are human and we like quick fixes. But more than anything, what people want is the quick fix that doesn't cause another cascade of problems down the road. We want the quick fix that is sustainable, that sets us up for success, that can then trickle down to our partners and our families and our kids, and is actually true healing.
Yeah.
That's what people want, is actually true healing.
If I had the caring to read some of the comments that will come as a result of these types of conversations, I love to read the good ones. I like to be reinforced. There's also this whole world, as you said, of nurses who they don't believe that their patients want to get better. They don't believe that it's possible to change not only their own practice, but to change their system. They think that they're already an expert on health and wellness coaching and that they have this all figured out. All of those things are total BS. There is no human on the planet who wouldn't want to do a little bit of effort and a little bit of coaching. That's all that it is. It's a little bit of coaching and it's taking some small action in order to see exponential healing in their life. There's no human on the planet who would want to trade a lifetime of suffering, side effects, doctor after doctor, pain, and that chronic pain leads to emotional pain, leads to spiritual pain, broken down relationships. There's no human on the planet that would rather have that than spend 5 hours with a nurse coach and have their whole life turned around holistically, mind, body, and spirit. I don't know a single nurse who would rather choose to believe and live inside this broken model without understanding like, oh man, it's so easy. It's so simple to learn this process, but you do have to do the work, right? If nurses were inherently taught this, and we mentioned this, right? What nurse learned about lifestyle coaching in school? Zero, absolutely zero. We don't even learn about nutrition. If we do learn about nutrition, it's confusing, it's weird. We're more worried about like how it impacts the cellular level than like just don't eat processed foods. Avoid sugar, avoid soda, right? Like we're afraid to say those things. So we don't receive any lifestyle coaching. Doctors don't receive any lifestyle coaching. The whole model is designed to keep everyone stuck inside of that. But there is that alternative way, which is common sense. It is just common sense, but it's also uncommon belief. It's uncommon belief that we can do better as nurses, that people want to heal. They want to change their life. Stop blaming them for being non-compliant.
Non-compliant.
Right? We call everybody non-compliant. We're like, why would people want to be compliant? It doesn't work, right? Their medications isn't making them better. It doesn't make them feel any better in the long term, right? It's just making them worse and worse. Like, would I want to be compliant with something that like doesn't make me feel good? That's why I left the traditional medical system, is because why would I want to be compliant and complicit in something that just totally is full of suffering and just way out of alignment with everything that I truly believe about health and healing. So let's bring common sense healing. Let's make common sense healing common practice through the art and science of nurse coaching again.
Not only by what we're able to coach our patients on, but also what we are able to then give back to ourselves as nurse coaches. Because just like you pointed out that we don't need to be the experts in order to be able to provide that level of support, I think something that all nurses need to hear is that we also don't need to be the perfect example of what it means to be healthy and well in order to be an incredibly powerful nurse coach for somebody else. The beauty of this process is that as that student was supporting her client to make changes in her nutrition, to move more, to decrease her stress, her wheels in her own mind started thinking. And she described this process of, I started to be able to focus on, these are some things that I'm really struggling with as well. Okay, here's my opportunity to then be making improvements in my own life as alongside my client, because I have the tools, not only to help another, but to then flip around and help myself.
Yeah, I love that part of nurse coaching, and how like every single nurse coach does not have to be an expert in everything. All you have to do is be an expert in holding space, asking powerful questions, and you don't have to have everything figured out. Just like that person isn't perfect, you and I have been able to support 4,000 nurse coaches. Heaven willing, like we can support 40,000, tens of thousands of nurse coaches without being perfect ourselves.
Yeah.
You know, I mean, shit, I got 6 hours of sleep last night. We got a new kid at home. Sometimes I go totally off the rails with my diet. I was just, working on a personal project that I'll talk about on a different episode for the past couple of weeks. And, I gave my all, right? So I was totally out of balance in my own personal lifestyle. We just come back to center. You come back to center and you do the best that you can, while also realizing like, man, you don't have to be perfect. Like anybody who tries to think that you have to be perfect, like you'll never be able to take action. And instead, like you and I have been able to help thousands of nurses become nurse coaches. Our students have been able to help literally like over 100,000, maybe more, hundreds of thousands of people to improve their life and their health and their happiness, because we realize like, we don't have to have it all figured out. We don't have to have all the answers. We don't have to be experts. We don't have to be perfect in our own life. All that we have to do is commit to the process of nurse coaching, because it is common sense and it is uncommon belief in betterment. For the nurse who's feeling fired up after hearing this, what do you need to tell them? What do they need to know?
For the nurse who's feeling fired up after hearing this, if you have been craving bringing common sense back to the forefront of healing, if you have been craving that holistic approach and to stop being a part of the crazy, mad system that is just creating more and more side effects, disease, human suffering, quite frankly, all for the profit and benefit of somebody else, and instead you want to be a part of true healing, that's what nurse coaching is all about. And you do not have to do it alone. There is the most incredible community with open arms waiting for you, and you do not have to guess. We have every single part of the pathway laid out for you. And something very cool that we didn't share a couple of episodes ago when we talked about all of the new changes and upgrades that we launched is that we also are offering something we've never done before, which is a 5-day money-back guarantee when you take the course. And I think this is critical because even though we have decreased the tuition to make it more affordable,
50%.
we have increased the value in every single aspect of the program. We have up-leveled the community, maximized connection to instructors. There's always going to be those fears and those doubts and those little voices inside you where you wonder, is this really for me? Am I really going to fit in here? Am I really going to succeed here? Is this really as good as it sounds like it? Don't trust me. Don't trust me. Come in and find out for yourself and then get your hands dirty, be a part of the community, soak it in, and you decide for yourself. Is it really as awesome as it seems? Is it really the future of healing? You find out.